Hi, welcome to my show, Enlifement. I am Doc Honeycutt. Thank you for joining me. I have a really good show today. For the whole month, I've been talking about mental health, mental illness, because I think that it's very important because people don't want to talk about it. Because the first thing that people think is you're calling them crazy. So they just kind of, push everything under the rug, mask it, and, nobody knows how they really feel. But today, I have two really special guests. I have Dr. Black and I have Dr. Okwara. I got it right? And they're going to tell us how the mind and the body connect. So as you know, we've been talking about the mind, body, and spirit on the network as well for this month too. So they're going to just give us more insight on it is a connection. So thank you for joining us.
Thank you.
Thank you for having us.
So I'm going to start with you, Dr. Black. Tell us just a little bit about you and what you do.
I'd love to. So I'm Dr. Trasha Black. I'm the clinical director at Genesis Project, and we provide behavioral health services, and our real mission is to help families break cycles of poverty, addiction, abuse, oppression, all the different things that keep families stuck. So we are a mental health agency, mental health and substance abuse, and we provide, we have licensed clinicians, peer supports, qualified professionals, case managers. We have street advocates, whatever it takes to really wrap ourselves around families to help them become healthy. And I'm so excited that we have partnered with First Care Medical. Dr. Okwara is the founder and the lead physician at the medical director at First Care, which is a primary care and urgent care facility.
Yes.
And they take care of the body and have seen the need to also include behavioral health services to take care of the mind. So it speaks directly to what Dr. Honeycutt is saying about the connection between the mind and the body. The brain is an organ, just like every other organ in your body, that can get sick, that can be out of whack, that can, and you need to treat it to help it become better. And it's not that you're crazy if you have a mental health issue. We all have mental health. It's something that we all have to pay attention to and make sure that we take care of. And so when we are not doing mentally well, then research says that 91% of people who seek treatment for mental illness get better. And part of the problem, particularly in our community, is that they don't seek treatment. We don't seek treatment, and so we stay sick and we stay stuck. And we teach those same behaviors and trends to our children. So I'm just excited to be here and to partner with First Care and Dr. Okwara so that our communities can really get better for real.
That is so very awesome. Now, Dr. Okwara, why did you see this great need to partner with Dr. Black?
First Care is, I don't like to describe us as urgent care or primary care. We would like to see ourselves as comprehensive care. Because in our clinic, you can get all your services in one location. Most of the services you need, all the diagnostic tests is done in-house. We recently added in-house pharmacy. We see a large percentage of indigent patients that don't have access to care. And most of what we call indigent patients, for that word is, I think, is misuse, or patients that with lower socioeconomic group, they don't have easy access. It's very difficult for them to have access to good care. And most of the clinics are located in more affluent areas. As a result, they have difficulty getting access to care and they don't have access to transportation. So what we have done at First Care is to provide everything in-house. I did emergency room for 9 years. During my stay in the emergency room in New York and in North Carolina, most of the patients that come there have problems that can be taken care of in the doctor's office. But those days, most doctor's offices are not equipped to handle all these problems. As a result, I decided to develop First Care Medical Clinic to provide everything in-house. And the main goal that we have is to have easy access. If you're sick, you don't want to call your doctor and they say, okay, now I have a headache. I'll make an appointment in 1 week. You can say, just come in. All our patients know how to do that. And over the years, for the past 20 years, I've found that most of our patients that visit emergency most of the time have, mental health issue. And they make quick decisions. They don't make any long-term plan. For the past 10 years, I've had difficulty trying to collaborate with a mental health company that you can provide everything in-house. Unfortunately, we have a patient that comes to us at first care. I've had problem refer that to mental health multiple times. She's had multiple admissions to mental health hospitals. A staff from Genesis came in with that patient. I asked him, what company are you coming from? That's how I initiated the idea of talking to Genesis, and we talked, and we've had multiple meetings with Genesis, and now we can integrate through multiple meetings with Dr. Black. When you start something new, there's an error or some mistakes are made. We have since then smoothed everything out, and all our staff know what to do. And there's a national shortage of psychiatrists and mental health service, because to take care of mental health, you need a lot of patients to take patients. Because the best way I describe, I really don't like to call it mental health. I call it hormonal deficiency, because most common cause of mental health is serotonin and norepinephrine. Just like if you have diabetes, you don't make insulin.
Right.
If you have thyroid problem, you don't make thyroid problem. So they call it mental health. So I think they call it mental health because if you remember when you were in high school, they have some kids that are so smart. How can somebody be that smart? It's crazy. And a lot, you see people like Michael Jackson or Prince or LeBron James or Michael Jordan, what they're doing with their skill is crazy. So the right word, maybe over time, we can stop using mental health. Because of the stigma in mental health, patients have less tendency to seek care because somebody will say they are crazy. So I tell my patients, just tell them you have hormonal deficiency. Then I tell them to go look at, it's called stress hormone, serotonin and norepinephrine. That's what causes this problem. So now that's why the new psychotropic medication, that's how they work. They block the uptake or disruption or metabolism of this medication to build it up in your brain. So I think when I talk to our patients, especially patients that have bipolar disorder, schizophrenia, it's more of the extremes of mental health. So I think with having Genesis in-house, it makes it easy and make it more acceptable for our patients to seek care as soon as possible. When we refer them, it's okay now, maybe their friends look at them negatively, he's crazy, that's why. So if we have everything in-house, it makes it easy to get easy access to care. So, and I think we've come a long way with Genesis. We're having all our 7 locations now, and all our staff, they're enjoying what we're doing. It makes it easy for staff. We provide transportation for our patients if they need help with transportation. I think over time, if you have the major cause of high healthcare costs is because of mental health. But they have mental health, they smoke, they drink, they have other risk factors that put them in trouble. So if we can make it easy for them to seek mental care, then I think we can do a better job with the medical problems.
So, sorry, let me cut you off.
Okay.
Dr. Black, let's talk a little bit about, now, I didn't know that there were so many different types of mental illness until I decided I was going to write a book about it.
Oh, really?
So I started doing all this research, and I think in my book alone, I wrote about 15 or more.
Okay.
So what are some of the most common mental illnesses that you work with?
Okay. So Dr. Honeycutt, I've never actually counted to find out how many different types of mental illnesses there are, but there's a book that's about this thick, and it's called the DSM-5, the Diagnostical Statistical Manual of Mental Health Issues or Mental Illness. And so that book lists every single diagnosis that is out there.
As far as you, like the common ones that you all see.
So I think the common ones for us, there are mood disorders, and mood disorders are related to how we feel. It can be a major depression. There are anxiety disorders. Bipolar disorder is it's depression, but there's also periods where a person fluctuates between depression and what we call manic episodes. And manic episodes are kind of the reverse of depression, where you feel like you're on top of the world, you're the greatest thing since sliced bread, you have a lot of energy, and it's directly opposed to the depression, where you're tired, you're fatigued, you feel sad, you're tearful. So those are kind of the mood disorders. There are trauma-related disorders like post-traumatic stress disorders. There are compulsive disorders, obsessive-compulsive disorders, where someone has a compulsive urge to do something repeatedly, whether it's turning the stove off and checking the stove 20 times before I can go to bed at night. It could be plucking. Some folks pluck their hair, their eyelashes, or their skin. There are psychotic disorders. There are disorders of childhood, such as ADHD, which is what we tend to see in children, but what we're noticing now is that a lot of adults have ADHD continuing into adulthood. There are behavioral disorders that children have. You may have heard about oppositional defiant disorder, or ODD. We're seeing bipolar disorder in children at a younger age now, but there's another name for that in the DSM, and it's dysregulation, mood dysregulation. Those are some of the major.
I think for the layman, the best way, if you have depression have different subtypes of depression. If you have bipolar, have different subtypes. So for the layman, you have like 3 or 4 groups of psychiatric depression, anxiety, bipolar disorder, schizophrenia. So if you talk about ADHD, it's a subtype of different types of mental health problems. Like if you have diabetes have different subtypes. And some of if you have diabetes, can be socioeconomic induced. If let's say if you have somebody that is not okay, now you can go see a dietitian and say, go and buy like healthy food. It's expensive. Unfortunately, the cheaper food and the bad ones for you is like hamburger, French fries. And the same thing happens with depression. If you have a parent that is unemployed, if you have a child that is a teenager, have a child, the risk of that child developing psychiatric problem is higher, because you cannot have a 13-year-old raising a child. So it's the environment. Environment have a lot to do with this.
It has a lot to do with this.
I think the government playing a major role helping the less fortunate. You can save a lot of money up front. So like you have group homes. If you have group homes, address the problem early and capture the kids before they become a teenager, there will be less problem for the society. So the goal here is not to build bigger jail or expensive jail. So it's to spend that money up front from kindergarten.
Early intervention.
Early intervention is the key. That's like if you do that, you can solve most psychiatric problems, a lot of mental health problems.
But to me, like a lot of them have similar characteristics. So how do you get to the root of which one you actually need to treat?
Well, there are specific criteria that determine which area a person's mental health issue falls into. So it may be similarities, but they're really structured checklists that clinicians use to determine which diagnosis is most appropriate.
So I was going to say, well, how does integrative come into play with the mind and the body, that you all working together?
I think for forced care, the integrated part of it, we see a lot of patients have diabetes, high blood pressure, cardiac problem, multiple problem, and if you have multiple medical problem, you can say, why me? You can become depressed. Diabetes can lead to depression. So if and you need to see somebody for counseling, and when you're depressed, you have less tendency of taking your medication, and that leads to more complications. And it's more you can prevent denial. People can go into denial because it's okay now, because I have diabetes, you try to do avoidance, smoking,
don't show up for your doctor's appointment.
I think that's having Genesis in-house make it easy. They can just walk down, have somebody can relate with, and you don't have that label. I think more important for us. If I say, okay, now I'm going to refer you to a psychiatrist, can say, okay, I don't want to go there, I don't want to go there. So, but having Genesis in-house makes it easy. It's part of the group. So when you come to forced care, for example, your friends or family members may not see you as great, but you're taken care of mentally in-house. So
mental and the medical.
It's done in-house. It's easier. The patient don't have to make multiple trips to get the same service. So I think that's what I've seen, good progress with what we're doing. So.
And what I see is, and I think we're all on the kind of the same page, that I believe that mental health issues are a physical response to emotional stress. And we all have emotional stress in our lives, and some folks have more than others. And so when they have a natural reaction, a natural physical reaction to the emotional things that are happening in their lives, mental illness may occur. So, there are different ways to treat. There's absolutely psychotherapy is very important, but there's also the medical component. So we must fix what's happening in the body. And so that may mean needing to see a medical doctor. That may mean medication. Doesn't mean that medication has to last forever. For some folks it will. They're going to need that medication to maintain stability. But we have to get the body back on track, and the therapy helps deal with the emotional stress so that your body doesn't continue to respond in that same way. So I think it takes a dual response, an integrated response, to really treat the whole person.
So how do you get these patients? I see a lot of mental health patients. They'll take the medication. They feel like they're themselves again, and they stop.
Well, I think here's what I think people fall on kind of two extremes. We have a lot of folks who will go to their primary care doctor and they will say, give me a pill, I'm feeling depressed, I'll take the pill. But they never deal with what has caused the emotional stress.
Right.
So they can be on that pill forever, and then eventually they may get tired of taking the pill because they think, one, I may not need it, or I shouldn't need it, I should be stronger, but they haven't dealt with what's caused the physical reaction. And then I have some folks who they will be in therapy for 2-3 years, and they don't understand why they still feel depressed, and we will encourage them to take medication, and they say, no, medication is bad, I don't want medication, I should be stronger, I shouldn't have to take medication. But so they never really get better.
I think the problem we have with mental health, let's say if you have diabetes, you can come in and check your blood sugar is 400. It's easier for me to explain that to you. Or if you have thyroid problem and check your TSH is high or low, then explain that. But mental health, we don't have any way of measuring.
You don't have a rating.
Measure. I think in the future we're going to be able to measure. You come to a doctor's office and measure your serotonin level, measure your norepinephrine level. But there's no way to measure that. On that serotonin, you have different subtypes of serotonin. One for happiness, one for depression. So there's no way to tell how deficient you are. So that's why if we give you antidepressant medication, it may work or may not work. Some patients may decide to stop taking their medication because of the side effects. What you tell them, we have to keep trying something until you find something that works for you. If that patient have a history of taking, let's say, Prozac, and Prozac worked for them in the past, or work for a family member, then there's a high chance that it's going to work for them because there's some genetic component to it. What causes depression or anxiety, schizophrenia, is multifactorial. So you tell the patients, I use the analogy of, for ladies, I tell them, how often you go to make up your hair, or go to a hairdresser. So why do you have to go every week to make up your hair? I say, because I have to look good. That's okay. They said, that's why you have to take your medicine every day to feel good. So, but I say, I can bet you if you say, okay, now you're not going to put makeup anymore. I say, okay, I'll stop taking your medication. They say, I can't do that. I said, okay, then we have a deal. Then take your medicine and you go do your makeup. So.
But I also think part of the frustration with medication is folks are used to immediate gratification. And so they think, just like if I have a headache and I'm going to take a Tylenol, then in a couple of hours or a little bit of time I'm going to feel better. Where psychotropic medications typically don't work like that. Usually they take a couple of weeks to really build up where they will start to see an effect. So then they'll start to take the medication, and it's been a week and I don't feel better, so I just stop. And that's the challenge.
What I tell patients, in your brain, there's a part junction, we call it synaptic junction in your brain. The synaptic junction, that's where the hormone comes with serotonin. If you say like, there's no way to know how deficient you are. So what's the SSRI, not receptor blocker? It blocks the metabolism of the serotonin. So we don't know how deficient you are. It may work for you faster, it may work for the next person faster. So you have to take it because there's no way to measure how deficient you are. So we have to keep trying what dose is going to work for you. So that's why you have to come for follow-up. You let us know if you say you're having X side effect more than the other, we can say, okay, let's change to something based on your side effects. You can have depression where you cannot sleep. You have depression where you stay up all night, and we pick the medication that can help you sleep. In something like trazodone, it's for depression, but it can help you sleep. So we have to pick which medication you're going to use. If somebody smokes, we use Wellbutrin. Wellbutrin is for depression too. It can also help you with smoking. So use it for different things. Depends on the symptoms.
So I think that like sometimes when you get depressed, it's just something simple. Like your body may not be getting
enough sunlight.
Yeah, enough sunlight, or like you said, enough serotonin. And so do you all kind of look at like the simple things, as far as the blood work first, as far as the minerals, vitamins, things that our bodies make,
if you have depression, you may have like thyroid problem that can cause depression. If you have diabetes, it can lead to depression. Other medical problem, that's why we do some blood tests to check, make sure there's nothing. We can check your vitamin B12 or vitamin D level, check everything first. If they're all normal, then we can say, okay, we can start treating. And everybody can get depressed. But if you're, a good analogy I use is, if you have a car, you don't have a brake pad, you go to a traffic light, you can't stop. You're going to have a wreck. But if you have a good brake pad, you can stop. Somebody can have depression, you come out of it as you have a good brake pad, so your body can generate enough serotonin to get you out of it. But people that have depression, they don't have enough of that hormone to deal with the stress. That's why they are called stress hormone. It's a stress hormone. They handle different stress levels, depends on. But if you are deficient in it, then you can't make anything. Then just like if you have diabetes, if you eat, you don't make enough insulin, your blood sugar is going to go up because you don't make enough insulin. The same analogy applies to depression.
And I'm so glad you said that, because people don't understand. They'll be like, well, I just ate a little piece of candy. And I'm like, yes, but it's detrimental to your body, because your body cannot, it doesn't function right, to break it down. And, well, I just ate a little piece of cake, and I'm like, that little piece could kill you,
Everybody's going to have diabetes if you live long enough, because I call it, a form of menopause. Because your pancreas don't make insulin. What causes menopause? Because you don't ovulate anymore. The estrogen goes down. The same thing with diabetes. Human beings are not designed to live this long. So people used to live like 30, 40 years, that's long, but we can live up to 100 years now because of modern medicine. We can live much longer. And we have better diabetic medications now. We have newer psychotropic medication coming out now with much less side effect that can address all these problems. So I think the future looks very good for us.
I think the other thing to keep in mind is, you said everybody can get depressed. So yes, some days I might feel sad, I might feel depressed, but for clinical depression to meet that criteria, there is a consistent level of sadness and all these other symptoms for 4 to 6 months in order to meet that clinical. And I think at the point that a person is clinically depressed, it typically takes some type of professional intervention to come out of that depression. Your body is not bouncing back with the serotonin.
Right. And I just, like I said, everybody has, at some point or another been depressed. But, just thinking about the people that stay in that dark place, like all their lives,
And it's really, it affects every area of their lives. I spoke at a conference a couple of weeks ago, and I used the analogy of rose-colored glasses. And some people have rose-colored glasses and the world looks great all the time, and that's wonderful, but some people have really cloudy gray glasses, and that's what depression is. The whole world looks great. Everything is less happy. I'm always irritable. Things just feel bad.
It's either hot or cold, right? It's like it's not. It's either 0 or 100. It's no in between. To a lot of people that I see that suffer from depression, they're either having a really good day or it's just not.
It's flat.
That's where psychotherapy comes to play. So we can give the medication. If somebody that's going to keep encouraging them that it's going to get better. It's not that it's going to get better. If you have diabetes, you need to go see a nutritionist, you need to exercise, but with depression, psychotherapy helps. Constant positive reinforcement is very important. Yes.
And it's important for folks not to stay in that place. Because I think when you're depressed, you believe that it's hopeless. That's one of the symptoms, a pervasive feeling of sadness and hopelessness and despair. And so you think there's nothing I could do to possibly feel better. You can't even imagine feeling better. But there is help out there. As again, I said 91% of folks who seek help when they have a mental illness like depression get better with treatment. So if you know someone out there who is depressed or you yourself are depressed, send them into First Care so that they can see the medical doctor, they can see one of Genesis clinicians, because help is available. You can and will feel better if you take that next step to get some intervention.
And stigma is a major deterrent for seeking help. Stigma, because if you go to a building and say mental health, I prefer not to call it just hormonal deficiency. Just already there, just tell me you don't have enough stress hormones, so you don't have to tell it. It's nobody's business, though. So you have bipolar or schizophrenia, so it can happen to anybody. Yeah, it can happen to anybody. I think having empathy when you take care of patients and people, it can.
And that we've all been there.
Yes, because people look at the big picture. They don't look at, you might have had problems, as well. They just look at where they are. So it's good to be able to have somebody that can connect, with them.
Well, I think we also, Genesis offers a service called Peer Supports. And peer supports are individuals who are in recovery from substance abuse or mental health issues who are now, they've done their treatment, they're better, they are now kind of lay counselors for individuals. And so not only do we assign licensed clinicians, but some of our patients can get the peer supports. So they do have someone who has been exactly where they have been, who can go to their home when they can't get out of bed to say, you know what, you can make it. Let me get you to your doctor's appointment and get them in to see a Dr. Okwara.
And the big thing we do now, we have in-house pharmacy. I saw a patient that came in with his mom. He's supposed to be taking olanzapine for bipolar disorder. Then I wrote for olanzapine. We called Walgreens. The cost for olanzapine is almost $300. So we were able to get the same medications for $25 per month. So that's what we've done. So and I think it's access. This medication, they're very expensive. The costs for this medication with regular pharmacy is just too high. So we do have in-house pharmacy now to help patients out, with all their medications. That's wonderful.
So y'all, that's our show. I want to thank you for joining us. But guess what? We're talking about doing Doctors of Charlotte, right?
Yes.
We're talking about it. So hey, yeah. But anyway, catch me right here every Wednesday on the Wake Up Call Network. And I want to thank you all again for joining me. Y'all got to come back.
Thank you for
Great show. Yeah, good information. Thank you.
Thank you.